So, good morning all. I would like to present our journey on Tactile, which is a tactile marker on eye drop for patients with low vision. Imagine a visually impaired patient who has been prescribed the three different types of eye drops. The biggest challenge here is identifying which drop to use now, how many times a day, and how many drops. These patients always need someone assistant to administer their drops, make them more dependent on caregivers, losing their confidence, which may result in missed doses, medication errors, compromised recovery, and complications. And studies have documented cases of inadvertent use of both ophthalmic and non-ophthalmic medications, highlighting this as a significant issue. And many of our patients are struggling with the same issue, so there has to be a better way. Our question was, how can we create a practical and affordable solution to help visually impaired patients instill their eye drops independently? Our answer to this question is Tactile, which is a tactile or touch-based marker system on eye drop for patients with low vision. Tactile basically composed of a label embosser machine which is available in various online platforms like Amazon and Flipkart for less than 1000 rupees. It is used to create raised numerical markings by pressing at a desired alphabet or number. And this label strip is refillable to the same embosser, make it more economical solution. And the embossed strip is one side sticky is then attached to the eye drop bottle. And patient is trained to touch and feel the lines, and the number of vertical lines implies the number of times the eye drop should use. And instead of vertical line, we can press any number. For example, if we want our patient to put 2 drops at 4 times, we can press the number 2 at 4 times. And this is how we use it, the tactile system, making the embossed label marker by pressing at number 1, and after our desired dose we cut the label by pressing on option marked as scissors, and it is attached to the eye drops. The whole process of tactile marking will take half a minute only, and hence it is very time consuming procedure. So for evaluating the impact of Tactile, we conducted a study to compare the treatment adherence, patient satisfaction, and medication error rates between patients with standard eye drop application and tactile labeled eye drop application. Our intervention group consisted of 50 VIA surgery patients who received tactile labeled eye drops, and control group consisted of same number of patients who uses usual eye drop bottle without tactile marking. And patients with cognitive disorder affecting touch are excluded from the study. It was a prospective questionnaire-based study conducted in a tertiary eye care center with a sample size of 100 post-operative VIA surgery patients, and data collection was done within a period of 6 months. And patient is trained to use the tactile system within 1 to 2 minutes on the day of surgery. And patient feedback is taken by a structured questionnaire based on Likert scale at the end of 1 month when they are coming for their second post-operative visit. And questionnaire mainly consisted of 6 variables: whether they maintained correct dose and dosage, did they miss any doses, independent installation possible or not, how easy was it to instill their eye drops, how satisfied they are with their eye drops, and about the symptom improvement. These were the 6 variables I checked. And result shows that 84% in the tactile group were able to maintain correct dose and dosage against 60% in the control group. And there is less incidence of missed doses in the tactile group comparing to the control group. And 82% in the tactile group reported easy eye drop installation against 54% in the control group. And the most important good thing about tactile is 78% of them were able to manage their eye drops by themselves. And there is little difference in the symptom improvement, but tactile group was still better. And overall mean satisfaction score is 4.5 out of 5 in the tactile group against a 3.2 score in the control group. So tactile is a simple and cost-effective scalable tool which improved treatment adherence, hence less medication error cost. And it promoted self-installation and thereby reduced caregivers' load in post-operative VIA surgery patients. We also noted that patients with worse visual acuity benefited more from tactile. So concluded as introduction of tactile markers on ophthalmic medication enhances patient safety, reduces medication error among visually impaired patients. It promotes independence and thereby boosts their confidence. It has potential for smart integration and is suitable for widespread clinical implementation. We hope it brings smile on their faces and thereby brightens their future. These are my references. Thank you.
Good presentation. I had the opportunity to see the same in poster podium also, and we were able to touch and feel it also. They had brought the samples. Yeah. That's a great innovation. It's a very simple one, practically possible, and it will really help the low vision patients. Very good.
We appreciate that because bringing self-care to these patients is very important because they are at home all available for work, so that's a big thing, and they have to go on with the drug for 6 weeks. But the issues are when it's going to taper, how will you do?
Yes.
When right eye has 4 times a day, left eye would have been already operated, will be 2 times a day. So how will you handle two different drops for both eyes, especially in glaucoma patients? They take X for right eye and Y drop for left eye. How will we manage? So these are some things we have to work upon. But otherwise, the principle, in principle, it's a very good.
For tapering, we have a solution, sir.
What will
For example, if we want our patient to drop 4, 3, 2, 1 dose, we can first press four lines, 4 vertical lines, then a horizontal line, then 3 vertical lines, then a horizontal line, then 2 lines, then a horizontal line, and 1 line. For that.
and they will feel and go.
Yes, sir.
That will be very confusing. I'm not sure that will work.
I heard this presentation yesterday also by your guide, I
Yes.
think Prithvi.
Yes, sir.
Same one?
Invented.
Isn't it?
Prathi sir invented this, but I conducted this study with the post-operative.
You conducted the study.
Yes.
Very good.